This session will be doing corona vaccine in COVID-19 patients. Here, the important thing what we will be covering is different questions which a person may or may not have regarding the COVID positive test and the vaccination. So the questions like if you are currently COVID positive, what should you do? Should you vaccinate or not? Are you currently lactating? Are you currently menstruating? Should you get vaccination or not? Those are certain questions which we will address in this session. So, by this time, almost everyone is well aware of what coronavirus is, what COVID 19 is. So, corona or coronavirus is the infection which leads to the COVID 19. Now, this is a severe acute respiratory syndrome caused by coronavirus type 2. It is one of the RNA virus. There are several viruses, the DNA virus, the RNA virus, and the COVID or the SARS COVID-2 is particular nomenclature for this session or this coronavirus which we are currently suffering. There are several SARS infections in the past in 2000, early 2000s, and the world has seen the epidemic of that. The pandemic which is happening currently is COVID-19 caused by SARS-CoV virus 2. This is a RNA virus. Now, in brief, this virus or COVID 19 has two phases, the phase 1 and the phase 2. The phase 1 and the phase 2, they are all important clinically. So, these two phases are termed as clinical phasing. What it means is in phase 1, the phase 1 which lasts for around first 6 days or maximum 7 days, here the maximum virus replication happens. Replication, duplication is the terminology where virus replicates itself. So it makes a copy of it, another copy of it, and continues to grow in size in the body. So the first 6 days, the person may be asymptomatic to begin with, and over the period of few days, they will develop symptoms like cough, dry cough, fever, breathing difficulty, and so on. So those are the first 6 days. Now, in the first 6 days, the person should be very well aware of what the COVID is, what are the precaution, what kind of a treatment they should be receiving. All those they should follow. The second phase, which is the seventh day to 12th day phase, this is a phase where in the first few days, if the person is asymptomatic, they will feel that they don't have COVID-19 and they would start being more lenient when it comes to public awareness, when it comes to taking care of their hygiene, sanitation, hand washing, masking, all those things. And the person may stop those things. And that's where the problem starts. The 7th to 12th day, this is the phase where there are maximum complications. A person who initially had mild symptom or was asymptomatic without symptoms now will start to get more and more severe symptoms, more and more higher grade higher grade fever, very high cough, the frequency is high, the breathing difficulty is more severe, the bouts of a dyspnea or something which we call shortness of breath also is very high in these 7th to 12th days period. Now this is all complication phase. Worst you can imagine, this is the phase where the worst complications can also happen. Remember, the name of the virus itself says you what it can do to your body. It's a severe acute respiratory syndrome, meaning it will lead to a respiratory failure. The respiration, the breathing will stop if it goes to a worse scenario. So, first phase for 6 days, more or less mild or asymptomatic patients. 7th to 12th days, which is a phase 2, is the complication phase. Now, this is important clinically. Now, I'll explain how the COVID vaccine goes with the infection. The first and the foremost is, if you see this slide here, I have explained the COVID 19 infection status, the vaccination or not a vaccination plan, and how long to wait in case if you need to wait. Now, anyone who was never infected with COVID 19. They never had a positive test, they never had any symptoms, they were never in exposure or in contact with COVID 19 patients and never traveled. Those people, should you vaccinate or not? Yes, you should go and get yourself vaccinated with full dose, two dosage, which is the current recommendation. And for this, you don't need to wait. Whenever you get a vaccine, get it done, finish it. I will cover the time duration for the second dose, but whenever you can get the first dose done, the second dose in the time period prescribed. So you were never infected, get yourself vaccinated as early as possible. Don't wait. If you already had COVID 19 infection, so in the past or in the present, you already had COVID 19 infection and currently suffering from it. So if you're currently suffering, we will cover it. But if you already had infection in the past, so what should you do? Should you vaccinate or not? Should you wait or not? The current recommendation is again to get vaccinated for full two dosage, but in the countries like India, which is developing and is in constant news of for a variety of reasons, one of the reason is not having enough vaccination for their own population. Here, the vaccine scarcity or vaccine unavailability makes the person think whether they should get the full dosage vaccination or not. The current recommendation, as I said, it's a full two dosage, but if you cannot get the second dose, at least you should have vaccination for at least one dose. This is a minimum required. You cannot wait for this. You shouldn't wait for this. You were COVID positive in the past, get yourself vaccination done as early as possible. Now, the next one is where the majority of the questions come, the COVID 19 symptoms and what to do with it. So, a person, now we already saw that if the person had COVID infection in the past, you should get vaccinated. But what if you currently have symptoms of COVID? What is the status? What should you do in this scenario? Here, I have mentioned again the COVID 19 infection status, vaccination or not, and how long to wait for it in case if you need to wait. Now, if you see the first scenario where the person is currently COVID positive, the person is currently COVID positive, meaning the person has a COVID 19 test positive. Now, what should that person do? A test is positive, the person is symptomatic, there are mild symptoms, for example, say fever, cough, mild shortness of breath. What should they do? Should they vaccinate or not? The current recommendation is do not vaccinate. If you're currently COVID 19 positive with the test results and with the symptoms, do not vaccinate. Wait till you have the full recovery. This could be another 2 weeks, 3 weeks, maybe another month. But unless and until you are fully recovered, do not get yourself vaccinated at this moment. So, in mild or asymptomatic patients, where there are mild symptoms, a fever, not a very high grade fever, 100, and in this scenario, a person may or may not be positive at this time. They are asymptomatic and have a mild symptoms. So what should you do? Again, you should not get vaccinated. In this scenario, currently it is not recommended to vaccinate yourself if you have mild symptoms of COVID-19. What do? You wait at least for 10 to 14 days since your first inception of your first symptom. So the first time you had your symptom, say 1st of January you had the symptom, so you wait for 10th of January or better 14th of January. Till that time your entire symptoms are under control. Till that time you do not get vaccinated. You have a mild symptoms, don't get vaccinated. Wait for 10 to 14 days. Current recommendation. Moving on, again, if you have a fever, you are currently having a fever. As I said, it comes under mild infection, but people have a separate question of fever only. They may not have cough or other symptoms, shortness of breath, dizziness, or loss of sense of smell, and all those things. If they do not have that, and if they do have a fever, again, same goes, do not get yourself vaccinated. Wait for at least 24 hours. Now here it's a very specific terminology which we should pay attention to. wait for at least 24 hours without fever reducing medication, without antipyretic, without paracetamol, without any drugs which will reduce the fever. Wait at least 24 hours. When the symptoms are completely improved, then you go for a vaccination. You follow the first dose, you follow the second dose. That's when you should get yourself vaccination done. So that's a fever. And what should you do when it is a fever? What should you do in a mild symptoms? Wait for 10 to 14 days. If you have fever, wait for at least 24 hours without fever reducing medication and then get yourself vaccinated. What if you have test positive without any symptoms? There is just COVID-19 test positive, RT-PCR positive. What should you do in that case? You have no fever, you have no cough, you have no shortness of breath, no anosmia, no change in alteration in taste and smell. What should you do? Again, do not get yourself vaccinated. Okay, if you have test positive, wait for at least 10 days after your first positive test results. So wait for another 10 days, as we gave the example here. 1st of January your COVID-19 test was positive, RT-PCR was positive. Wait for at least 10th of January before you go for vaccination. Okay, so do not get yourself vaccinated within first 10 days. So wait for 10 days, and after that you get yourself vaccinated. Again, read the instructions. Okay, the terminology vaccination or not vaccination, when I mention test positive, do not vaccinate, doesn't mean that you do not vaccinate ever. It's not forever. You do not vaccinate for first 10 days. That's why how long to wait, that section has been added here to clarify when to get vaccinated and when not to get vaccinated. So read this carefully, understand what is written. Ask me questions. If you have any questions, put it in the comments. I will answer it. COVID-19 treatment with monoclonal antibodies or convalescent plasma. This is one of the type of a treatment where a person who is COVID-19 positive is given a treatment in variety of formats. Maybe simple paracetamol, those will be treated separately. And some people are currently getting the convalescent plasma, monoclonal antibodies. These are the treatments. What should you do if you are receiving these type of treatments? Should you vaccinate or not? Current recommendation, again, do not vaccinate. If you have, do not vaccinate for 90 days. Be careful on that. Do not vaccinate. Wait for 90 days after recovering from infection. So COVID-19 treatment with monoclonal antibodies, convalescent plasma, in this scenario, you wait for 90 days and after that you get vaccinated. Don't get vaccinated immediately. That's what it means. The reason for that is the convalescent plasma and monoclonal antibodies. These are the antibodies which are already been given to you as a part of a treatment. When there is an antibody in your body and you take a vaccine which has a role to create antibody in itself, then the vaccine will not act. The vaccine will not be effective. So you already have a monoclonal antibody treatment done. You have a convalescent plasma. Remember both these, that antibodies and plasma, both these are externally given antibodies to the patients who have COVID-19 positive status and who are moderate to severely ill. So mild infection are treated separately, moderate and severe are treated with antibodies and plasma. In this scenario, wait for 90 days after recovering from infection. Remember, 90 days after recovering from infection, and after that, you get vaccinated on your daily schedule given by your government. That's how you do for the mild symptoms and what to do with the vaccination.